My name is Jeff Singer, MD. I'm a general surgeon in practice in Phoenix, Arizona, and I'm a senior fellow at the Cato Institute in the Department of Health Policy Studies.
I want to first start with what I think is kind of the heart of your book, which is bodily autonomy. Can you define what that right is?
Bodily autonomy is a classical liberal precept that we as adults own our own bodies and have the right to decide what to do with our bodies as long as we don't infringe on the equal rights of other adults. If you don't respect bodily autonomy, then you no longer own yourself. So, for example, if the state starts to dictate to you what medications you are allowed to have, what kind of healthcare professionals you're allowed to consult, or even what kind of foods or recreational substances you're allowed to consume, then that means you're property of the state. There's no respect for you as an adult to make your own health decisions. At that point, it's just a matter of, it's a slippery slope. How much is the state going to allow you to do with yourself? It could be a lot or it could be very little. My profession, the medical profession, it's only a recent development in the last 50 years or so that has become just drilled into all of us. We marinate in it, actually, while we're in medical school. So from the beginning of medical school, we're taught you must respect your patient's autonomy. You can't do anything to them, perform a test, a procedure, or even administer a treatment without them having given you fully informed consent. That means you told them the risks, the benefits, the alternatives. And if they decide they don't want to take your advice, then we're told you must respect that, even if you think they're making a terrible mistake. They own themselves and it's their decision. So that's been taught to us. But that's a relatively recent development. In fact, it was much more commonplace for the doctors to view their patients almost like their children. A very famous case kind of marked the beginning of the end of that. It was like a turning point. In 1908, in New York City, a woman named Mary Schloendorff was a patient at New York Hospital, and her doctor suspected that she had a tumor of her uterus. Now, in those days, of course, we didn't have the imaging that we have today, CAT scans and MRIs and all that, so it was very common to do what's called an examination under anesthesia, which even today we rarely, but still have to do. Her doctors recommended an examination under anesthesia, and Ms. Schloendorff said, "That's okay, but I don't want you to do anything if you find anything. I want you to wake me up and discuss what you found, and then we'll discuss a plan." So the doctor took her to the operating room, put her under anesthesia, appreciated a uterine tumor, and then went ahead and did a hysterectomy. And she had all sorts of complications, some of them pretty terrible, but she survived, and she was upset, understandably. So she sued, and she won on the first round, and then it was called Schloendorff versus Society of New York Hospital. Then it was appealed, and writing the opinion for the unanimous majority was at that time, Judge Benjamin Cardozo, who later became a Supreme Court justice. The actual words are in the book, but he basically said that every adult of sound mind is a sovereign individual that owns themselves, and to do something to them without their consent constitutes an assault. And Mary Schloendorff was assaulted. And so that was a very important case that to this day everybody cites. It didn't change everything right away. It wasn't until around the mid-70s or so that medical ethicists started making a big issue about respecting autonomy, so that medical students entering medical school from about the mid to late 70s on learned no other way but the current way. In fact, a lot of young doctors probably would be shocked to learn about the way our behavior was in the past. But meanwhile, while my profession finally, it took a long time, but my profession finally got it, the government does this kind of thing all the time. I have to basically accept his risk-benefit assessment. My risk-benefit assessment doesn't count, doesn't mean anything. It tells us what kind of healthcare practitioners we're allowed to even get advice from. So states have licensing laws, and with those licensing laws, there's something called scope of practice. Over the decades, as medicine has become more sophisticated, many of what were originally sort of affiliated health professions they've gotten more sophisticated too, so that they are actually competent and trained to do things that doctors also are competent and trained to do. But depending on the state you're in, the government of that state may say, well, I don't care, you're not allowed to get advice from that person. Even if you want to help someone reduce the risk of their choice, because the government doesn't approve of their choice, not only does it deprive the person who makes that choice from getting access to something that can make that choice less dangerous, but it also punishes people who try to help them get access to that choice. So these are some of the ways in which the government has not learned what my profession has learned.
You started this saying doctors used to see their patients kind of like a child, so in a very paternalistic way.
Yes.
And now the state, like when we talk about big government, we call it paternalistic. Is how has this relationship gone from the doctor to the state, and why has one learned the lesson and the other one hasn't?
I think it might have something to do with the fact that since the doctors are dealing with people on the individual level, there's more of an accountability, and it puts a human face on the person with whom you're interacting. Whereas in the case of the government, you usually have some distant bureaucrats who don't know the individual people whose lives they're interfering with, and who are not necessarily accountable. It's not on the individual level. So you have a distant bureaucracy dealing with sort of faceless, anonymous people.
After Autonomy, you talk a lot about informed consent. Can you explain what it is applied to the health sector?
Yeah. Now, and I must admit, doctors are humans too. So occasionally, even though we're taught otherwise, we'll be in a hurry or get lazy, and so we will transgress and not give fully informed consent. But that's what we're supposed to do. So that means that when I see a patient, and I'm a surgeon, so I'll use the surgery example, and I think they need an operation for their problem. So I have to explain to them why. I have to explain to them what that operation entails, what could go wrong, the chances of it going wrong, what the alternatives to the operation are to treat the problem, and what not doing anything would do. One of those court cases in the early 20th century that I mentioned to you about actually came to the conclusion that withholding certain important, crucial information from your patient that may have made them make a different decision is a form of manipulation, and in a way is actually fraudulent. And so just as defrauding someone violates their rights, is a form of theft in a way, so is not giving fully informed consent a form of defrauding through manipulation.
And we've been talking a lot about informed consent with the doctor, but going back to the government.
Well, it's even worse because not only am I not being told by the government why it's not letting me have access to a medication, let's say. It's just saying you can't because we don't think it works, or we don't think it's safe. But even if I do my own research and I go on the internet and I see all of the research showing some of the potential risks, potential benefits, I can see the research showing it's inconclusive and all that. So now I'm really informed. As far as the government is concerned, we don't care. You could be as informed as you want. We decided for you that even if you think that the benefits outweigh the risks, our benefit risk assessment is what counts, not yours. So we are making the risk benefit assessment for you.
Do I have a right to make decisions that are even bad for me?
Of course you do. You have a right to do anything to yourself as long as you're not jeopardizing the equal rights of others. So for example, using a drug that alters your consciousness, like alcohol. If you're going to get yourself to the point where you're mentally impaired and then get behind a vehicle in a busy commercial street, you're putting the lives of other people in jeopardy because you might crash a car and kill somebody. So there, the government has a right to say, if you're going to use alcohol, you can't get behind the wheel of a car. Similar things with other drugs. So that, to me, is a legitimate, acceptable role for the government to play. But as long as you're not putting other people's life in jeopardy, the government doesn't have a right there to stop you.
After informed consent, you talk about your right to self-medicate. And you talk about how these are kind of the two sides of the same coin that cannot be separated. Can you explain what the right is and what the connection is?
Yeah, it's a corollary of the right to informed consent is the right to self-medicate. If you don't have the ability to treat yourself, then then even giving consent about a treatment is meaningless. In fact, it's so fundamental to autonomy that historically, Thomas Jefferson was giving a speech to, I think, the people in Virginia about why it's so important to preserve the right to free speech. And to illustrate it, he said it's as sacred as the right to self-medicate. Because people in those days understood that if I can't medicate myself, then I don't own myself. How could I treat myself? How could I, I'm totally at the mercy of another person. Nowadays, the coin is flipped. So we have this situation where people like me are having to say the right to self-medicate is as sacred as the right to free speech. It's the completely other way around. Interestingly, in the 1930s, when Congress passed the Food, Drug, and Cosmetic Act of 1938, which created the modern-day Food and Drug Administration, if you look at the record, the transcript, the authors of the bill actually said, we have no intention of infringing on the rights of people to self-medicate. The only reason we're doing this is we want to make sure that whatever they self-medicate with is safe. I would argue, well, I appreciate very much you telling me whether you think this is safe or not. I might value that information, but you still don't have a right to stop me from taking it. And I maybe want to hear some opinions from other investigators as to whether they agree with you that it's safe or not. So, but unfortunately, when Congress created the Food and Drug Administration, it doesn't matter what other opinions are, and it doesn't matter whose opinions I value over that of the government. It's the government's opinion that counts, and that's all.
Was it actually ever that way? Were they ever just evaluating and recommending and not actually prohibiting?
Actually, everything started in 1906 with the Pure Food and Drug Act. Up until then, there was no government involvement at all. There's, of course, liability laws. There was competition, et cetera. And there were private organizations that were doing the vetting and screening of drugs. For example, the American Medical Association, as one example, created the Council on Pharmacy and Chemistry. And they said to all of the pharmaceutical companies, if you want us to designate you as an ethical pharmaceutical company, you have to submit to us all of your data on all the medications that you're producing so that we could vet them and pass judgment on them. And if you don't do that, we're going to actually list you as not an ethical pharmaceutical company, and we're not going to let you advertise in any of the numerous medical journals that we publish for doctors in this country. And there were other organizations too that were filling the role that we now have given a monopoly to the FDA. By 1955, the AMA disbanded that council because it was, already kind of preempted by the FDA. So, but in 1906, Congress passed a law saying that whatever you sell to people, it has to have in it what you say it is. And if it has anything in it that could potentially be harmful, like alcohol or opium or something like that, then you have to display that on a label. That's all it did. And you could argue, okay, that was like a Truth in Labeling Act. That's not interfering with autonomy. It's just that would be more making consumers more aware, okay? The Federal Bureau of Chemistry eventually became the Food and Drug Administration in 1938. At that point, the government decided everything that's in existence right now is grandfathered by virtue of the fact that it's been around this time. It doesn't have to get our approval, but any new product that a pharmaceutical company makes, before it could sell it to anyone, we have to be convinced that it's safe. And that was the only thing. It remained up to the pharmaceutical company to decide whether they sell their drug over the counter directly to the consumer or prescription only. In 1951, the Durham-Humphrey amendments were made to the Food, Drug, and Cosmetic Act, and said, okay, from this point forward, it's not up to the drug company, it's up to the government. Now, once it becomes a government monopoly decision, it's subject to, or vulnerable to, political considerations and special interest pleading. When you put the decision in the hands first of all, when it's in the hands of a monopoly, then it doesn't matter what other people think because the monopoly makes the decision. But especially when it's a government monopoly, no matter how good the intentions are of the bureaucrats running the agency, it's going to unavoidably be subject to political and special interest pressures, which, remember, these pressures are telling this government agency what you, as an autonomous adult, can do with yourself. So all these other people are deciding about you, for you, about you. And if people just understand that all of these regulations, these are other people who don't know you, who are making these decisions for you that you have the right to make for yourself.
It stuck with me that you said about the potential harm that that's where everything started with the FDA started to go wrong. It's like, okay, but you can die of drinking too much water.
Yeah, there is such thing as water intoxication, by the way. You could kill yourself from drinking too much water. So maybe we ought to have the government supervise you when you're drinking water, making sure you don't drink too much. Well, the point is, a lot of these things come with good intentions. I mean, the people mean well. They're concerned about their fellow human beings. So I don't want to accuse them of being nefarious. The point is that even if they're correct, even if what they want you to do is good for you, they need to respect your rights. It's not their decision. So freedom is messy. In a free society where people make their own choices, some people are going to make bad choices. We're going to see things happen to people that we don't want to see. That's the price you pay for a free society, and it's worth it.